Hello, everyone. Welcome to Wind Down Wednesday. Thank you so much for your patience. We have Terry here. Hi,
How are
Terry.
you? Yes, I'm here.
How are you doing?
I'm doing great. I've got my glass of wine.
Oh, I have my glass of water. Well, ear cheers.
I know because I'm in my home office, so I can actually have a glass of wine. You're actually still working.
Good. And hopefully everyone joining us has their glass of wine or preferred beverage too. So thank you everyone for tuning in. We're very excited to have Terry join us tonight to talk about her profound experience. And my name is Brittany Bankson. I work at the practice here as our laser and energy-based specialist. And we have some slides that we'll be walking through this evening. You all know Terry. I'll let Terry introduce herself before we jump in.
So I'm so excited. I've been a meteorologist at Wood TV since 1995, so I'm coming up on my 25-year anniversary. I've been in broadcasting for more than 30 years and co-host of 8 West since we came on the air with our show back in it was 2009, the very first year of Art Prize. So as you know, that makes me, if you do all the math, turning 56 this year. And aside from one other laser procedure that I had with Dr. Bankson's office about 8 years ago, the profound treatment is the only other thing that I have ever done in terms of anything cosmetic with my skin or my appearance. I haven't done Botox, I haven't done any fillers or anything like that along the way. I've actually had come to the point where I thought about doing a neck and chin lift about a year ago, and I called Dr. B and I said, hey, what do you think? And he said, I've got a laser treatment that I think would be perfect for you. And so that's where my journey began with Profound.
Awesome. And I'm going to jump into a couple slides here that actually talk just a little bit about the science behind Profound. So if anyone has questions, feel free to type in those questions in the sidebar. We'll be sure to answer those. And we'll be chatting with Terry in just a moment about her experience. Enjoy that wine for me. So we notice a lot of changes in the aging skin. We discuss these during your consultations, but as we age, we start to go from that oval to rectangular shape. And just as Terry mentioned, a lot of patients come and see us and are contemplating, do I pursue a surgical option? Do I really need that? Nobody really wants surgery, but sometimes we get to the point where we want to take that next step. And Profound is a great in-between for people that want to see some changes in their skin, are starting to notice a little dull tone, maybe some static lines and wrinkles, lower face laxity, and some jowl formation. So the three reasons why those facial wrinkles begin to form is because we notice a decrease in collagen every year. We have this breakdown of the scaffolding of our skin and our tissue. Our elastin production stops, and elastin is that key fundamental that helps with snapback to the skin. So I know, Terry, we talked about that and kind of seeing a reduction in the snapback and how quickly your skin bounces back into place. And then hyaluronic acid diminishes, and that's really our natural volumizer and hydrator within the skin. So the cool thing about Profound is that it's addressing all three of those skin fundamentals. We see a stimulation of all of those. It's long lasting, it's a single treatment procedure, so you don't have to come in for a lot of continuous treatments. And it's non-surgical, so you don't have to go under the knife until medically necessary down the road. But this really does an amazing job of addressing skin quality in a whole new way. So, and Q&A with Terry. So I'd love to jump in, Terry, and have you share more about your experience. I'll kind of go through the questions on the bottom of the screen, but we'll pull you up here. So can we start with just by sharing what your consultation process was like with Profound?
So my initial consultation with Profound was with Dr. Bankson, looking at my skin and determining that while I do have some extra skin and a little bit of jowling going on, that there was the opportunity with Profound that through the process that my skin would actually be rejuvenated and all of that would come back. Is that sort of the explanation that you give to patients?
Yes, definitely. I think, when patients come in and they're pulling their skin back really far, we really need to establish realistic goals of what we're able to achieve with a non-surgical solution like Profound. But I think we'll be showing your photos later on in this presentation, and I think it's really nice to be able to show just kind of a natural uplift. It's your body's natural stimulation of these skin fundamentals. So it really does help with the foundational skin structures to make sure that you see kind of that nice contouring to the face again, the depth of those facial wrinkles starting to improve. And with Profound, we target really the lower face and neck area. So it's
well, and it was interesting because for me, it was really important that I maintain that natural look. And what I really felt like, especially as I watched the progression over the months after the Profound treatment, like just how much it looked like I had taken a step back in time, that this was my own face shape, my own natural skin tone and quality, all just resetting itself basically.
And I know you had some great photos taken too in our photo room. So that's another piece of the consultation. We always like to track progress, showing that progression of pictures with our 3D imaging system and also with the high-tech camera system we have there, almost like the 8 West newsroom there.
Exactly. And so the whole process itself was really simple. I had a vacation schedule, but I ended up having to go to work less than 48 hours after the procedure for a very brief period of time, which actually included that I was on television. And I was sort of nervous about that, thinking how much would I have recovered from the procedure by that point. And it actually was something I was on TV and nobody even asked me about anything. So the process is I know you'll describe, involves that microneedling and then also the laser treatment. So there was actually a healing process that my skin went through, but it was something that I was able to camouflage with makeup. And then within just a few days, I was back to normal.
Awesome. And so why did you end up choosing Profound? I know you had discussed potential surgery. What kind of led to your decision of deciding Profound was the right choice for you?
Well, I felt like Profound was great for a number of reasons. First of all, that it was non-invasive, that it was something that would sort of buy me a few years. At some point, I may decide to go through a more traditional surgical process, but this I felt like was something that would allow me to gain a few years on that process.
Awesome. And can you walk us through the day of your treatment? When you arrived, what did that look like? What was the treatment experience like for you?
So I arrived and went into a treatment room and changed into a robe, a pretty comfy robe. And I was with Alicia. Then she took off all my makeup, cleaned my skin, and then I had the local topical anesthetic put on. At the same time, I also had the gas.
Yeah, Pronox.
So that I really was not able to feel any of the sensations. It took a couple of hours, I think, and then I was out. And on my way home, I was able to drive myself to the procedure, home from the procedure, because it was not anything that was ingested into my system.
Correct. Yeah. So we do kind of a numbing process where we inject lidocaine and epinephrine. That really helps to blanch the skin, make sure that you don't feel anything during your procedure. The Pronox is amazing. It's a 50-50 mix of nitrous and oxygen. And within 5 minutes, you can drive yourself home. So we love utilizing that instead of pain medications. And post-procedure, did you have any pain following the treatment?
I did not have pain following the treatment. When you leave, there is a wrap that they put on your skin because of the microneedling, and then just to kind of hold everything in place. And that really kind of helped the first 24 hours with the healing process beginning. And that was about it. I mean, I just remember, and then there's a cream that you put on your skin several times over the next couple of days. And that was about it.
Awesome. So we have a few more questions here, and we'll be sure to open it up for patients as well. So how many treatments do you need is a big question that we get from patients.
So I had one treatment.
Yeah, absolutely. And that's the beautiful thing about Profound is you really just need one treatment. People always ask too, how long does it last? And as Terri mentioned, this is something that she'll age out of over the next couple years. So it's hard to put a time frame on it. Everybody kind of ages at different rates, but we're looking to kind of turn back the clock a little bit in that gradual way. So you still look like you and can really benefit from the overall response.
Right. Yeah. And that, and that was I had such a great experience with it because of the way that the whole process helped my body just rejuvenate itself. I mean, I really felt like I turned back the hands of time. I can look at pictures and I really feel like my skin tone and the shape of my face is more like I had maybe in even my early 40s.
Awesome. And we have a question here on the right that says, how is this different than microneedling? So I can definitely answer that one. Mechanical microneedling is what most of our patients are familiar with. And with mechanical microneedling, you're just going in at a 90-degree angle. We do a lot of mechanical microneedling with our FDA cleared device. That's kind of like aerating the lawn. It allows for us to allow for product to penetrate deeper into the skin. With Profound, it's really microneedling on steroids. So we have injectable energy in a way. This incorporates heat into the tissue, and it's the only device out there that is a long pulse. So when you look at the picture on the upper screen portion here, you can see the needles insert into the tissue, and it delivers a little heat pocket in your skin. So it's deep down, it's protecting the epidermis, but that's where all of our skin fundamentals lie. And we want to trigger the optimal wound healing response without under treating. So the system uses a thermometer coupled technology that measures and monitors that the entire time. So it's incredibly safe. As Terri mentioned, she was incredibly comfortable because we numb the skin ahead of time. There's just a little bit more social downtime compared to typical microneedling. So we tell people usually 3 to 5 days of social downtime. Terri mentioned she was back to work within a couple days and kind of was able to cover the areas with makeup. So most commonly we see patients experience a little swelling and potentially some bruising, but we do our best to kind of prevent those from occurring and decrease your downtime overall.
So I see a question here. Did the procedure hurt and how long did it take before I started to see results? So I would say that it was a little uncomfortable. For me, the worst part of it was just the injecting of the numbing medication. But I have to imagine I'm not somebody who has ever had anything surgically done to my face or my neck or any other part of my skin or sort of that surface area. But my pain certainly a lot less downtime than any of that would have been. And I started to see results within, I would say within the first 30 to 40 days, I really started to see the results. Initially, I saw the results in terms of my skin quality, the tone of my skin as the microneedling part of that was healing. I really just felt like the whole surface of my skin was much softer and I got this firmness back. And I started to see some of those wrinkles and laugh lines really start to be minimized.
Excellent. And so we get a lot of questions about what does that healing process look like. This is, oh, nice little, you look beautiful. Shout out, you do look amazing. And so this is before, immediately after, 2 days post and 6 months post of another patient that was treated with Profound. This is a patient, actually one of our materials managers, Deb, and she had Profound and CO2 done, which is a resurfacing laser that we sometimes will combine. So you can see Deb had some bruising in those areas, primarily from the numbing process, but she also had a little resurfacing laser done as well. And we will go through full photos during consultations if patients have specific questions about that too. So you spoke about when you started to see results in 30 to 60 days.
I did I started to see noticeable results within, the first 30 to 40 days. Oh, these are my pictures.
They are. So this is Terri before and after 8 months following her treatment. And does have makeup on in the after photo, but even with that, you can see just the contouring of your jawline. I mean, Terri, you look beautiful.
Thank you. Yeah, it's almost hard to believe. It's stunning when you see the pictures side by side.
Definitely. Yeah. And we noticed too a lot of improvement just in the depth of the facial wrinkles. We have a couple other views here. And I think you can see that oval shape really restored nicely to your jawline following the treatment as well.
Wow. This is the first time I'm seeing these pictures,
I
Brittany.
know.
I can't even
Great.
believe it.
It looks beautiful. Yes.
Yeah.
So, and it's crazy because a lot of people see us from our profile. We don't always see ourselves from that, side angle. So, yeah, your results look fantastic. So,
Oh, yeah, that's incredible.
and another question that we get is what other areas can be treated with Profound? So, we definitely have noticed a huge improvement in the facial procedures that we've done. We also have an FDA clearance for cellulite with Profound. So we're moving on and starting to treat different body areas, which is very exciting. So there's a lot of, I would say, untapped potential with Profound, and we're starting to explore that as a practice, in addition to continuing to offer the great results for face and body. So there's questions too about the cost. I'll be sure to answer those. And Terri, I'd love to circle back with you just with some final comments and any other questions that patients have. But anything else that you'd like to add just about your overall experience before we move on to the savings?
Yeah, well, I'm still stunned. I'm almost speechless looking at those before and after pictures because I had not seen those side by side like that. But that's exactly the result that I was hoping to achieve. I watch myself and I feel like I've taken very good care of my skin on my face, but it really has been my neck and then my chin area where I felt like my age really reveals itself. And so by going through the process with Profound, I really feel like I've gained, this extra amount of time before I would ever do anything more invasive to address those
Absolutely.
areas. So, but I think it's a fantastic option. It was definitely a fantastic option for me with, minimal downtime, the fact that it was minimally invasive, and then just to see the results happen so gradually. And the fact that it wasn't, I don't have people that say, oh, you look so different. You don't look like yourself anymore. I really look like myself, but just a younger version of myself because this has been nature just kind of helping to rejuvenate my skin at all layers.
Absolutely. Well, you look amazing.
Thank
Thank you so
you.
much for joining us. And yeah, we'll be sure to circle back and say goodbye in just a moment here. So we talked about other areas that are treated. We also get questions too about how does this compare to some of our other technologies. So at the Bengtson Center, we have really great foundational technologies. Therapy is another one of our technologies that we use to stimulate collagen in those deeper layers. There's no downtime with therapy. You can really return right back to your normal daily activities. So, and that's something that sometimes patients will repeat a couple times a year. With therapy, we do a lot of addressing kind of the upper layers of the face. So it's cleared for a brow lift. And then for Profound, patients that want a little bit more in the lower face and neck area, we typically will use Profound in those areas. So we can discuss the difference with you when you come in for your consult and determine what would be best. And when you're ready to book your consult, you can definitely email us at webinars@bcaps.com or at info@bcaps.com, whatever is most convenient for you. And that provides a really good savings for you as well. So that complimentary consultation is really a great way for us to determine what the best treatment plan will be for you. For non-surgical treatments, is Profound the best treatment for jowling or other great treatments? We talked a little bit about therapy. And, when you're looking at some of the mid-face areas, because we're losing bone, muscle, collagen, and fat as we age, we kind of need to address those things, not just with a single treatment or modality, but normally that consultation really entails, where do we start? What bothers you most? How can we pull together a game plan and a treatment plan that helps to provide the best results for you, also based on your budget. So we can take all of those things into consideration to make sure that your game plan really suits those goals for you. I had a question about if it helps with lines above the lips. So that's another big area of concern for people when you look at kind of the perioral region. With Profound, we're addressing the lower face. So it's kind of this area here and under the jawline. We can extend down onto the neck a little bit. But specifically for lip lines, that is a perfect combination with the CO2 resurfacing. So that core resurfacing that we use, we can target specifically around the mouth to really help with those lip lines. We also are able to use the laser around the eyes. So for those kind of fine lines and crepey skin around the eyes, it's a really fantastic combination again. They both have about the same downtime, and we can use them the same day to deliver the optimal results for you. Yeah, and Terri's photos are amazing. We were very excited. We track progress. We have you come back a week after treatment, and then a few months down the road. Results can continue to improve 6 months, even out to a year based on histology. So typically that 6 to 8 month mark is when we have you come back in for additional photos to kind of track your progress. Yes, and thank you. Terri just commented her photos were at the 8-month mark. She's so happy. And Terri, we're so grateful for you. Thank you for joining us tonight. And hope everybody enjoys your glass of wine. I'll be joining you very soon. Thanks again. And we look forward to hosting more of these virtual seminars. Hope everyone enjoys a wonderful summer. Can't wait to see you all again.